Here we have a nice 9-minute YouTube video. This video is a wonderful example of a person who is truly in excited delirium, and B, that is very well taken care of by not only law enforcement, but the providers that respond on scene. For sake of time for this presentation right now, we will not watch this, but you are welcome to click that link and watch the video. It is a great informational resource and a great example to kind of have logged away in the back of your mind. Treatment for excited delirium. Obviously, the biggest thing with these patients is that they are so hyper aggressive and in such a hyper agitated state that they do run the risk of some very serious medical complications, up to and including sudden cardiac death. We want to be able to control these patients with physical and or chemical restraints, largely with chemical restraints. Benzodiazepines as a first line agent, so Versed, at least that's what we use in Wake County. We want to put these patients on cardiac monitor, obviously, with everything going on metabolically in their body. They run the risk for cardiac dysrhythmias. Patients are largely hyperthermic. That is a classic sign of excited delirium, why they don't want to wear clothing. We want to start getting them cooled, cooling them with IV fluids, with cold IV fluids, starts that process. Loosen restraints when possible. Obviously, these patients have significant extremes of strength because they will largely be usually uncooperative until they are sedated. We want to keep the restraints slightly loosened so that we don't cut off circulation to any extremities, things like that. We want to transport to proper facilities without delay, and we want to make sure that we reassess these patients frequently, because oftentimes they go from one extreme to another without it being recognized, and unfortunately that can end up in a negative outcome for the patient. Here again, I have the behavioral health protocol screenshotted from Wake County EMS. Here it discusses the treatments for various behavioral problems that patients may have. You'll see on here that midazolam, or Versed, and haloperidol or Haldol are first-line agents for providers in Wake County EMS. Going further, these medications are used in behavioral emergencies. As I said, Haldol, haloperidol is the generic name. Is an antipsychotic agent which works to block dopamine receptors in the brain, creating a sedative effect. Additionally, we have Versed, which is a fast-acting benzo or benzodiazepine used to decrease agitation and create a sedative effect in patients. As I said, these are two very widely used and very well-known medications within the pre-hospital setting. Lastly, safety concerns and risks for pre-hospital providers. As seen with a lot of these behavioral emergencies, patients do become combative. It is in our best interest to attempt to verbally de-escalate patients before using any sort of physical or chemical restraints. Additionally, it is always good to have law enforcement on scene, not only for patient safety, but also for provider safety.